thank you for organizing this. Given there is a really high chance I might run out of time, I put the acknowledgement first. And so I just want to acknowledge the founding and the people that make this possible. This whole work is actually part of a dissertation done by Xuan Hu. She could not be here, so I'm just presenting on her behalf. But a little bit of background. I mean, we heard about this for the past 24 hours. We heard about having about 10% of people that report persistent symptoms have been classified as long COVID worldwide. We've been talking about risk factors of long COVID, things like female, BMI, having comorbidities. We also find that having a lower household income and a higher deprivation index is related to long COVID. Well, I think what we didn't really talk about is the effect of long COVID. And so we see that in many countries, there is a reduced workforce participation following the pandemic, and it's still not clear how much of this is actually due to COVID. So what we want to do here is to looking at the relationship between long COVID and employment in two different ways, which are both important if we want to go on with like new policies or targeted intervention. So the first of our aim is to see whether employment is an actual risk factor for long COVID or not. And so it's a certain group of people are more at risk of getting long COVID depending on their job. The second thing we want to look at is, well, now that you have long COVID, will that impact your future employment? And so you can think of that impact your future employment, most likely will it impact all your future life. To answer both aims, we did use data from the REACT study. You heard about that yesterday. But it's pretty much was launched in England in 2020 to track the prevalence of SARS-CoV-2. It's made up of two main studies, REACT-1, that looks at the prevalence of SARS-CoV-2, and REACT-2, that track the prevalence of antibodies. The study ran from April 2020, and some of it is still running. And so part of the people that we have in REACT 1 and 2 have been followed up in the REACT-LC or REACT Long COVID studies. And we are now assessing the impacts of infection on health and well-being. There's quite a lot going on because there's quite a really big cohort that we have. But to answer our aim one, and so to determine whether the type and nature of employment are risk factor of long COVID, we used a subset of REACT 1 and 2. So we had about 275,000 participants for which we had information on employment. To answer aim 2, and so to determine whether long COVID has an impact on employment, we use data from REACT-LC. And so we use data here, we have like about 107,000 people that were within REACT-LC. So they're also a subset of the data that we use for aim 1, for which, again, we have information on symptoms and employment. Two things to notice is that for aim 1, data goes from 2021 to 2022, while for aim 2, that's subsequent data after collection in REACT 1 and 2. All the analyses are logistic regression model adjusted for known variables, so adjusted for known risk factors, things like COVID variant, COVID vaccination, whether or not you have previous comorbidities. And I'm just going to show you here odds ratios and confidence intervals, and then you'll just go through the results that we have. Starting from the first questions, I told you to answer the first question, we used data on about 275,000 people. I just thought it would be interesting to see what the main characteristics were. And so the majority were women, white, without previous comorbidities. And our outcome was long COVID, which we define as whether or not you report symptoms for longer than 12 weeks. And there's about 15% of people reported long COVID. We have 3 different exposures. So the nature of employment, which is like whether you work full-time, part-time, you're self-employed or not working. The type of employment, that I've listed them all there. And employment rights, and here we may just, do you get sick pay if you're off work? Or the last one that's really interesting is that, well, if you are off work for 2 weeks, does that impact your finances? And this is all self-reported measure. And so those are the main results and the few things I want to highlight. The first one is the healthcare worker that's at the end of the forest plot, and we find that healthcare workers had a 47% higher odds of developing long COVID after adjusting for all known factors. Also, people who work in logistics and security had higher odds of long COVID. Those are police officers, firefighters, delivery drivers, people who work in public transportation. We also found that nature of employment and whether you have access to sick pay was not associated with odds of long COVID, and that people who reported serious financial impact of time off work had a 29% higher odds of developing long COVID. So in the interest of time, I'm just going to move into the second of our analysis that looks at how long COVID impacted employment. And this is a subset of the population that we've seen before. And so even here, then we have the majority female, white, and without previous comorbidities. The outcome here is a yes or no question, a yes or no variable. And so participants were asked whether they had to reduce their work hours due to their health. And health, we mean both mental and physical health. And about 8% of them say, yes, we had to. We had a bit more information on persistent symptoms, and so we could actually define long COVID slightly different, and that's the exposure for this analysis. And so we define a variable on like 4 different levels. There's people who have either no symptoms at all or symptoms up to 4 weeks, between 4 and 11 weeks, and then the last 2 are what is called long COVID. So 12 weeks or more of symptoms, but we add information that allow us to divide this into 2 groups. And so those are people who resolve long COVID, and so the symptoms lasted long, but now they're over. And then people who still have symptoms at time of the study. And again, this is some of the main results. People with ongoing long COVID were 4 times more likely to reduce their work hours compared to those who recover within 4 weeks. We did find a dose-response relationship because it's not on the slides, but people who resolve long COVID, so they had symptoms but they don't have it anymore, they were actually 2 times more likely to reduce their work hours. Both part-time and self-employed workers were more likely to reduce their work hours compared to people working full-time. And I think for self-employed workers, it was like 3 times more likely. And I think you can see from the plot there that individuals in any public-facing roles, so whether that's healthcare workers or like police officer, they were more likely to reduce their work hours compared to people in non-public facing roles, with people who had the opportunity to actually work from home. And so just what they will learn from this, well, healthcare workers and people who feared loss of income from time off work were more likely to develop long COVID. Participants with long COVID and those working part-time and self-employed were more likely to reduce their hours of work. I think what this finding demonstrates is that COVID impacted work in different ways. And depending on what is your employment, that impacts your risk of COVID. And so when we think about long-term support, when we think about intervention, when we think about policy, we need to think about which sectors have been disproportionately impacted. And this is hence my talk. If you have any questions, I'm happy to take them.